Today, I'm going to talk about care for the caregiver, and this is a really big topic, and I could talk about it for days. This is my absolute. This is the thing that I'm going to work on the rest of my life. Long after I leave clinical anesthesia, I'll still be teaching and trying to spread the word about this. And today, what people think about when they think about care for the caregiver is they think about what's on the screen today. If you guys can see it, it's a person on a beach and his wife or significant others laying out. And that is one aspect of care for the caregiver. But that is just a tiny piece of what we're going to talk about today. We're going to talk about a lot of different aspects of this. And in my past, this is what I did to get better, try to feel better. I went on vacation, and usually, involved, partying and having a good time, and that really didn't cut it. My name is Rodney Overstreet. I'm a CRNA. I come from a nursing family. I'm a third generation nurse. My grandmother studied under a physician and took her boards without even going to school as an LPN. My mom was an associate's degree nurse, and my uncle was a naval CRNA. And I looked at him and thought that looked like a lot of fun. And so I decided to be a CRNA, a certified registered nurse anesthetist. In addition to that, I am a compassion fatigue educator through the Green Cross Academy of Traumatology. They're actually responding to the fires right now with trained compassion fatigue and PTSD educators. I want to send my utmost love and support to you guys, because I know that it's really hard right now in LA. My brother lives in Torrance, and he was here this weekend at my house, and we got to spend a lot of time together and talk together about what was going on. I'm also a consulting hypnotist. Hypnotism, it sounds kind of woo-woo, but you can look in PubMed, and there's hundreds and hundreds of studies that show the beneficial efficacy of it. I'm also a wellness coach. Also got 4 kids. I'm got a wife, and I'm a full-time call-taking nurse anesthetist at a small community hospital here. I'm doing nights this week, and I was just saying earlier that last night we had a ruptured bowel that I finished the day with, and then I started my day this morning at 4 a.m. with emergency C-section. Everything went well. Both patients got back to the unit and to the OB suite. Okay. Usually when we talk about modalities to heal and wellness in the wellness sphere, people get these ideas of like crystal therapy and naked yoga and sound healing. And you guys are being in California. This is not even a tough sell for you. I mean, there's all kinds of modalities that are beneficial and efficacious, but they're not all super out there and super woo. We're going to talk about a lot of those today. I try to engage in almost every activity that I talk about. Last week, I went to a place that does hot sauna and then a plunge afterwards. I think the sauna was 190 degrees, and we went right into a 40-degree, 4-minute polar plunge. And it was phenomenal. I've not tried naked yoga yet, but I've done a lot of yoga. I've done sound healing, and I've got friends who are really into rocks and crystals, and they charge them up under the full moon and stuff like that. But our objectives today are going to be, number one, we need to develop a language of suffering. So if we don't have the vocabulary, then we can't describe what's wrong with us. And my interest in this area arose from my own suffering. About 12, 14 years ago, I had little toddlers at home. I was working at a very busy hospital doing hearts, and I would be gone from 5:30 in the morning until 10, 11 o'clock at night. And I was paying the bills and taking care of the family. But I looked in the mirror one day when I was changing, and I was not the person that I intended to be. I wasn't the person that I was in college whenever I wanted to go out and change the world and heal people and touch them. And there was something that was going on inside of me. And so I got curious about that. About the same time, I had 3 good colleagues who ended up going to rehab, one after the other 3 years in a row. And about the same time that all this was happening, and I was going through my own issues, one of my mentors, who was a nurse anesthetist, she went back to veterinary school, was a vet, and was working hardcore in the Humane Society here in Birmingham, and helped build a new building. And she was a Boston marathoner. She took her life with propofol, and she was an educator too at our university. And about the same time, one of my classmates, who was a gifted triathlete, snow skier, mountain biker, drank himself to death. And so there were alarm bells going off left and right. I knew things weren't right with me. I was trying to figure out the world. And then COVID hit, and the fire became a true raging inferno, much like the inferno that you guys have been dealing with. and I saw, that we were really in trouble, and I didn't know what to do, but I had been doing lots of reading, lots of studying, lots of self-assessment, and I began to have a clear picture. Rumi has a quote that I really love. It says, "Once you begin to walk on the way appears." And I had been walking on this way for about a year, and so September the 25th of 2020, right in the middle of the first wave, I started Heal Our Healers, which is the nonprofit support group on Facebook that I run. And I started doing Zoom meetings weekly to engage with the community, and I started talking about the language of suffering. So today, that's what we're going to do. We're going to simply define terms describing clinical suffering, such as vicarious trauma, moral injury, compassion fatigue, burnout, and PTSD, clinically acquired PTSD. You guys have had some PTSD recently from the fires, and so the things that I talk about will resonate with you, and the tools that I give you will help you navigate this insult. The second thing we're going to do is we're going to list several signs and symptoms of the above insults. We're going to explain hallmark symptoms of PTSD. Always think about hair, like it makes your hair stand up on end whenever you have a PTSD response. Your sympathetic nervous system kicks off. Describe a boundary, its importance, methods to hold your boundaries, and how to correct an infringement. Discuss the non-negotiables in self-care, and demonstrate or discuss two of your favorite techniques to assess, address, or mitigate clinical suffering. The interesting thing is, because we are individuals, there is a tremendous amount of inter-individual variability. What works for me is not going to work for you, and what works for you is not going to work for someone else. And so I've developed a sort of a la carte toolbox that an individual can rummage around in and engage in activities that may resonate with their soul and their psyche and create healing, but it may not. And if it doesn't, that's okay. You tried it, and you know that it's not for you, but maybe it'll be for somebody else. Maybe you can introduce one of your colleagues to it, or one of your friends or family members. So the first big question we should ask, and I think we all know the answer, but it deserves asking, is, does the caregiver need care, right? Like, is this lecture worth it? As I was doing research, I came across some striking numbers. During COVID, the rates of burnout were upwards of 63% among physicians. Good news, it's starting to drop, but it's settled back to about its baseline. And that baseline is a very poor baseline of about 50%. In 2023, 50% of doctors reported feeling a great deal of stress in their job. That's kind of a no-brainer. I mean, every day we're dealing with sickness, disease, death. People who are unhappy with the state of their lives who are suffering. A study in 2023 found that 23% of physicians did not feel valued at all by their institutions. This is tremendously troubling because it shows that these physicians feel ineffective, and they feel like they don't have agency in their institutions, and that's a hallmark of burnout. So you can automatically say that 23% of physicians in this study are burned out or experiencing some of the symptoms of burnout. That's a real problem. Burnout makes us feel like we're not in control of our lives. Burnout degrades our ability to heal. Burnout degrades our ability to think clearly so that we can diagnose clearly, so that we can implement strategies and techniques and medications to allow a person the space to engage in healing. More than half of physicians surveyed reported feeling time pressures when conducting physical exams. I think that we all feel that. Certainly I do in a busy hospital. One of my physicians always says, time's money in private practice. He reminds me of that all the time. And so when he's tapping his foot, he's telling me that. And then the EHR, the electronic health record, has not really helped us. We hoped that it would be the savior. We hoped that it would be this thing that would streamline our lives and make it more simple. But really, it's made it more complicated. There's more button pushing and clicking, and now the people in the offices, the suits, can look at our production, and they have these metrics they can use to put pressure on us from above, and that can further increase our stress. Up to 20% of physicians meet the criteria for substance use disorder in a study from 2015. I do not think that's gotten better. If anything, it's probably gotten worse with COVID. And physician exhaustion, if you look at different studies, ranges from 25 to 60%. That is catastrophic. Compassion fatigue was the main thing that I was suffering from. And I love this from Ghostbusters. Ghostbusters was one of my favorite movies when I was a kid. And compassion fatigue is like this. This is whenever Slimer, the big green ghost, ran through Bill Murray and slimed him. And so the compassion fatigue educators, and in the literature, you'll read about people who become emotionally slimed or spiritually slimed. And I think that's such a great metaphor because it drives home the fact that when you engage with people who are suffering, you take on part of that suffering. I might go so far as to say if you are a healer and a caregiver in the process of creating a space and an environment for an individual to heal, you take on some of their sickness, some of their disease, some of their issues. It could be a story about sexual assault. It could be witnessing someone who has got a stage 4 cancer and who's passing away. It can be difficult conversations with families and colleagues. But when you get home in the evening, you are slimed, whether you realize it or not. And one of the ladies I really liked, she said, it's like walking through water and expecting not to get wet. And every single day, you and I are crossing over that fast moving stream into the hospital, to the clinic, to the operating room, and we're coming back home. And we're taking this stuff home with us. And that's the real problem. The real problem is this. We don't realize that it's there. We don't have good strategies to mitigate it. We don't have good words to describe it. And that's why I'm giving this lecture today, so that we can have words. We can develop some skill at looking at ourselves, at interoception, where we check in with ourselves and see how things are going. And then we have these tools that allow us to engage in activities that de-slime us, that clean our minds and clean our bodies and clean our spirit. Just culture. This was a little bit curious. I wasn't well versed on just culture, so I did some research into that, and I do like it a lot. It talks about accountability. It talks about a blame-free culture. Accountability, recognizing that both the individual and the system they work within can contribute to errors. It aims to balance accountability with learning from mistakes without automatically resorting to blame or punishment. And so I find this fantastic. There are systems that can contribute to burnout, compassion fatigue, PTSD. There are things like the timeout that prevents us from engaging in wrong psych surgeries. So whenever a situation occurs, we look at that situation and we look at how the algorithm or the system was in play whenever this thing happened. It's a learning environment. So it encourages an environment where employees feel safe to report errors or near misses. So there's good communication. These are cultures where management is supportive of the individuals, and they want to educate instead of punish. Promotes a culture of continuous learning and improvement, and that's ultimately the practice of medicine, right? That's why we want to use best practices. That's why we use evidence-based learning. Fair response, determining the appropriate response to human errors based on whether the action was due to human error, at-risk behavior, or reckless behavior. So this is a sort of a stratification of response to the situation. Does that person just need support? Does that person need education? Or was that person being risky and reckless and deserve some sort of punishment to inhibit that behavior? And it's systemic improvements. And ultimately, that's what we want to do as healthcare providers. As people in positions of power, we want to drive culture, and we want to drive institutions where we have processes in play that make those institutions safer and more supportive to the staff. So it's understanding that errors often stem from systemic issues rather than just an individual failure. And then we go into the boardrooms and we talk about ways that we can finesse and massage the system, and we can make that system more supportive to safety and mental health for the practitioners, so that we can maintain those nurses, doctors, physicians, techs who've been there for years and years, and keep all that knowledge, wisdom, compassion, and love inside of our institutions, inside of our communities. All right, so where do we start? Well, we start with putting tags on things, and human beings are meaning-making machines. We love putting things in boxes. We love putting tags on things. And so today, maybe you're familiar with all these, maybe you're not, but we're going to reinforce your education about these tags. So acute stress is something that just happens on the fly. It can be almost getting an offender bender. It can be a harsh word with a colleague. It can be getting into a small bleeder in surgery and causing stress. But these are very short-term temporal issues that occur, and then they're gone. Emotional labor talks about the demands of jobs like we have. We are highly educated professionals, but we're also kind of in a service industry. We're providing, a service to our community, to our patients, to our hospitals. And so we have to sometimes act in ways that don't necessarily reflect our true feelings. So maybe we've had a long day, maybe we're tired, maybe we're overworked, maybe we're stressed out at home, maybe there's bills or insurance issues because of damage to your property from a fire. You have to come into the hospital and you have to engage with patients and still be caring and compassionate and a good listener and a good leader. And so it's very demanding emotionally, our jobs. Our jobs aren't just demanding intellectually, which they are because we have to be, very bright and up to date on our knowledge base. But they're also emotionally demanding, tremendously emotionally demanding. And that's something I don't think that we acknowledge enough, the emotional toll that these jobs take on us. Vicarious trauma is secondary traumatic stress disorder. Vicarious trauma is just witnessing an injury or suffering and then taking on some of that suffering. So this could be childhood abuse. This could be taking care of a patient that's been raped, or an elder abuse patient comes in with stage 3 decubiti covered in feces, and it just breaks your heart. This is vicarious trauma. Whenever you're traumatized through someone else's story or through someone else's lived experience. And again, these things were not taught to me 25 years ago in anesthesia school or 30 years ago in nursing school. And that's one of the things that I aim to change in the future, is to have students who graduate with a good working knowledge of this vocabulary, so that they are aware of it whenever they step into the clinical area. And when they experience it, they can automatically tag it and they can realize that something's going on. Moral distress and moral injury, these are activities that occur that don't align with our core beliefs and core values. That could be assisting in putting in a PEG tube in a patient who we know is end of life. And maybe you even hear the family talking about, keeping that person's check in the family and trying to keep them alive as long as possible. Or it could be assisting with a procedure that you don't agree with, a plastic surgery procedure, or an abortion or something like that. And you carry a tremendous amount of trauma, of shame, of guilt home with you because you had to engage in that activity that didn't agree with your core beliefs, core values. Compassion fatigue, that's just the sliming, that's engaging with suffering every day, and you bring that suffering home with you. That suffering sticks to you in a mental, physical, emotional, and spiritual way. Burnout is more of a systemic, long-term issue. Burnout is chronic, and it's emotional, and it's physical, and you just feel exhausted. There's cynicism, there's depersonalization, where you almost feel like a robot moving through the world. You don't even see yourself as a feeling human being anymore. You'd have reduced personal accomplishment. There's low self-esteem involved because you're not operating in the capacity that you know that you're capable of. You're not the caregiver that used to be. You don't have the compassion that used to be. You don't have the love that they used to have for your patients and for your position and for your job. And then that creates a shame spiral because you're not operating at the level that you're supposed to be operating in. And then you feel guilt because you're not the provider that you wanted to be and that you were. And then you feel the shame. And so this is just it's a circular spiral sort of situation. It can lead to substance use disorder as a means to prevent or decrease your own suffering and of getting out of the situation. There's frustration there. There's cognitive impairment because you're so ashamed and so in your own head about the situation that you're having to deal with. And Bessel van der Kolk, in his book, The Body Keeps the Score, he talks about this subtle body that we have. That we have a mental map of our body. And if you're suffering to such a great extent that you can't relieve your suffering, many times the body will cry out in pain. And so we'll have headaches, we'll have TMJ, we'll grind our jaws at night, we'll have tight throats, we'll have chest pain, shoulder pain, neck pain. This is what I deal with in my hypnosis with a lot of people. Chronic back pain, The body keeps the score. Autoimmune diseases, like irritable bowel. If we're suffering and our body can't figure out a way out of the suffering, it will manifest a physical symptom to help try to explain that suffering in some way. It's crying out. Anxiety, depression, mood swings, and feelings of helplessness. It's terrible. It's just absolutely terrible. And whenever I started my healing journey, I was definitely suffering severe compassion fatigue, and I was definitely in the throes of burnout. PTSD specifically, clinical PTSD is a situation where I really don't like the PTSD because it's not a disorder. It's a PTSR. It's a post-traumatic stress response. It's not a disorder. Normal human beings have normal reactions to super abnormal things. If you get scared really bad, if you get hurt really bad, you're going to have a PTSR. You're going to have a post-traumatic stress response. And HAIR, like the hair stands up on your arms when you think about it. So it could be a tremendous MVA that comes into the ER, and you're down in the ER, and there's blood everywhere, there's chaos everywhere. Maybe it's a pediatric patient, and you smell. Maybe they've got like a chest wound that you've got to use Vaseline gauze, and you're caught up in all this trauma, you're caught up in the drama, and you smell that smell of the Vaseline gauze. And then from then on, every time you smell Vaseline gauze, you automatically are brought back to that event that occurred in the ER that day. And so the symptoms of this are hyperarousal. So when you've had a PTSR or PTSD, you're constantly on alert, you're hyperaroused, you're keyed up, you're in your sympathetic nervous system more than you should be, instead of just going in the sympathetic nervous system and resolving into parasympathetic. You have avoidance or anger, the A. And anger is typically just sadness turned outwards. If you're super, super sad about something, it manifests itself as anger because that sadness doesn't have a way to give voice to itself because we're not taught to debrief, we're not taught to ask for help. And so anger outburst. Intrusive thoughts, you can find yourself hyper-fixated on that situation and thinking about it all the time, and reliving or triggers. And the trigger, like I said earlier, that's the smell of the Vaseline gauze. Whatever your trigger is, whether it be that or whether it be a sound or a smell of bovie, or the trigger is just an event that occurs in your present life that acts like a bungee cord, and it pulls you back into the past. It zips you back to that initial incident. And then suddenly you're reliving that initial incident again. And when that occurs, you kick off your sympathetic nervous system and you're reliving that incident again. So that's PTSD or PTSR. Totally normal, but it's not good long term. It's not beneficial. We need to deal with it. So now that we have a vocabulary and now that we know that there's a problem, how do we fix it? Well, first thing we need to do is we need to create a space, a safe space around us, and that's boundaries. And boundaries are really important. Like speed limits and guardrails, boundaries create predictability and a set of behavior expectations. It's imperative that the individual has limits and guidelines to protect their personal space, core values, and well-being. These boundaries extend to physical, psychological, and professional spaces. And healthy boundaries create healthy relationships, maintain the self-respect of the clinician, and prevent burnout. Boundaries make you feel safe. Boundaries give you room to think and have agency and heal. I don't think any of us has ever healed anyone. We've just created an opportunity for that individual to heal themselves. There's a blueprint inside of us, and healing is the natural thing that occurs once we take away the pathogen, once we take away the cancer, once we turn down the proliferation of the thing. And we're the same way, emotionally and mentally and spiritually. We have to create some sort of space, container, and envelope for us to heal every day. And that's my intention here, is to help you guys learn how to do that. So when you're creating a boundary, or when you're looking at your boundaries, you want to be clear. Use language like I want, I need, I expect, I would like. That doesn't work for me. That's one of my favorites. If someone is trying to impose something on you that's not good for you, or it's outside of your ability or capacity at the moment, just say that doesn't work for me. And no is a complete sentence. You can just say no, and you can leave it at that. You don't have to explain yourself. Don't over-explain. Don't let your boundaries slide. Human factors. This is ergonomics. This is science of understanding interactions among humans. And in healthcare, typically it's just dealing with other people. And so I'm going to reinforce the boundaries idea here a little bit, because it's so important for us to to protect ourselves, because as a physician, you've constantly got other physicians trying to infringe on your boundaries. And you've constantly got nurses trying to infringe on your boundaries. And you've constantly got other techs and staff trying to infringe on your boundaries and your space and your time. And that's just in the office. That's just in the professional setting. That doesn't have any, we haven't even talked about patients yet. And so you've got patients trying to infringe on your boundaries and your time. And then you've got family members trying to infringe on your time and get information from you, get things from you. And you've got business, and you've got a spouse. So you've got to protect yourself, because you cannot pour from an empty cup, and no one's going to help you form your boundaries or keep your boundaries safe. So whether you're just getting started with boundaries or you're checking your fence lines, reflect honestly on the challenges and barriers to developing and strengthen your boundaries. Like, why are you bad at boundaries? And, it could be, I hate conflict. I don't like difficult conversations. I want to be a team player. I don't want to be seen as selfish. Well, I'm here to tell you, you don't have to light yourself on fire to warm others. You don't have to light yourself on fire to show other people the way. Saying no feels rude. Well, maybe you need to be a little bit rude so that you can reestablish a space or a place so that you can have room to rest. You need rest. Maybe you need that so you can have room to heal. You've got to heal. Shift your focus from reasons why setting a boundary is important. So get selfish. I have to take care of myself first. I cannot pour from an empty cup. I cannot be a good physician unless I'm rested and I'm calm and I'm peaceful. I can't be a good husband. I can't be a good father. My family needs me. Your family needs you. If things aren't going well at home, things are not going to go well in the clinic, in the office, in the operating room, because you're going to be feeling ineffective in one of your major roles in your life. It's hard. I get it. I've got 4 kids. I work full time. I've been there. Sometimes it feels like you're at the circus and you're a plate spinner and you're spinning the plates, and one starts to wobble. You have to run over and spin that one, but then 3 other are wobbling on the other side. It can be very challenging. I'm more effective at work when I've had a chance to rest and heal. That's just the truth. You're a better provider. You're a more clear thinking clinician whenever you're rested and whenever you're healthy mentally, physically, and spiritually. Identify the values you'd like to honor by implementing the boundary. I will be a better parent. I'll be a better partner. I'll be a better practitioner. And so that helps drive home the importance of caring for yourself. Caring for yourself is not selfish. Caring for yourself is one of the most selfless things that you can do, because ultimately it's going to radiate out into your marriage. It's going to radiate out into your family. It's going to radiate out into your neighborhood and your church and your community and your hospital. And so by you being a better person, a more whole and healthy person, a more awake and alert person, it's going to make the world a better place. Prioritize self-care to replenish your physical, emotional, and mental resources, reinforcing your ability to maintain boundaries effectively. If you join the Facebook group that I run, Heal Our Healers, I'll show you a link at the end. I posted a really funny little reel about a lady who talks about boundaries, and it's got a bad word in it, but it's super funny, and she makes a good point. So we're going to take a little break here. I know I've thrown a lot at you, a lot of heavy stuff at you, and I'm going to show you, and you may even be in your sympathetic nervous system a little bit right now, because we've talked about some triggering ideas. I've brought up some vicarious trauma that may have ignited some of your triggers and your ideas. And what this is the physiological double sigh. You can read about it. You can listen to Andrew Huberman talk about it. But it's one of the quickest ways to get out of fight or flight and get into rest and digest and repair. And that's what we want to do. We want to live parasympathetically. If we get attacked by a mugger, or if a mountain lion jumps on us, out when we're hiking, and we want to get in our sympathetic nervous system. But after that's over with, we want to get back into parasympathetic. So this puts on the brakes. What we do is we do a short nasal inhale, so through your nose. And then we're going to do a long belly breath. So I'll show you my belly, my dad bod belly, and we're going to breathe through the belly. As the belly goes out, the diaphragm drops, which gives us real estate. And then we're going to blow out slow. So again, James Nestor wrote a book called Breathe. It's a fantastic book if you're into respiratory physiology. You just want to understand it better. If we breathe through our nose, we humidify and moisturize the air. We breathe on top of it, and then blow out. So we got humidified, moisturized air. We're going to extract about 30% more oxygen from that air through the nose. So we're going to hyperoxygenate the blood. We're going to blow off CO2, and we're going to get alkalotic, which is more calming and soothing. We're going to stretch that belly. So through the nose, through the belly. And what we're doing literally is we are stretching the abdominal viscera. We're blowing the belly out. We're letting the guts sag. As those guts sag, they're innervated, as you can see here on the screen, by the vagus nerve. The vagus nerve supplies about 70% of the parasympathetic innervation to our body. So 70%. And it just drapes down through the chest, goes to the heart, and through the guts. And as you breathe with that abdominal breath, you stretch those guts out. As the guts stretch, those nerves get stimulated and they start firing. They send afferent signals back to the brain. Those afferent signals pop off into your brain. They hit the amygdala. They hit the default mode network. They start releasing endorphins, serotonin, dopamine, even oxytocin. Works better if you're hugging someone with oxytocin, touching someone. But you're getting high off your own supply. So if you find yourself frantic, angry, irritated, depleted, use the physiological double sigh. Let's just do 3. Good. Long exhale. One more good one. And hum on the way out. Mm. So what we're doing there is we're just using a little mechanical vibration to hit that vagus nerve. It'd be weird if you do this in public or the operating room, probably, if you hum. But if you're in the office, if you're in your car, if you're in a private spot, if you're in the lounge, do that double inhale and then hum on the way out. And feel your jaw vibrate. Feel your chest vibrate, your lungs vibrating, your abdomen vibrating. That vibration will further stimulate the vagus nerve and will increase the amount of parasympathetic signals going into your body and going to your brain. In parasympathetic, you feel safe. And if you feel safe, it gives you an opportunity to open up that space between stimulation and response. So many times in life, we're just stimulated and we respond, we're stimulated and respond. And that's not agency. Great job, guys. I hope you enjoyed that little break. So what does it mean to have agency? Individuals who are capable of monitoring their environment, adjusting the inputs to achieve their desired goal. We all want to be in control of our goal. We want to achieve our goals. It's intentional. It gives us authorship of our story, controls over actions and outcomes, responsibility for thoughts and feelings, responsibility for my thoughts and feelings. That's powerful. And freedom and autonomy. So when we're talking about self-care, there are some non-negotiables. These are the things that everyone should be doing every day. I'm not good at it always, but I try to keep this at the forefront of my mind. Quality sleep. So we want to have really good sleep hygiene. That means a mask if you have light contamination. That means ear buds that are noise canceling, or just stop up your ears with rubber stoppers or whatever you need. If you have a partner that has sleep apnea, or if you have sleep apnea, get those things seen about so that you can have good quality, deep REM sleep. The relaxing breath, I just showed you that, the physiological double inhale. Just 3 to 5 of those will make a tremendous difference in your day and how you're feeling and how you see the situation, how you see the world. Someone to talk to. This is just quality emotional time. Ideally, if you have a challenging clinical day, you'll have somebody you can debrief to. That can be a colleague, that can be a friend, a family member, it can be clergy, it can be a professional debriefing situation where you talk to a mental health provider in your hospital, or even through an app like BetterHelp. But you can just say, hey, I had a really hard day today and I'm mad about it, or I'm sad about it. And you don't have to give any dirty details. There's no HIPAA violations there. You just say, this thing happened, and this thing happened, and this thing happened, and I feel. And believe it or not, just giving voice to that traumatic day, that challenging day, that experience begins healing. Healing begins when you unburden your soul, when you unload your mind and you unload yourself a little bit. Sunshine, get outside. Vitamin D is good for you. Whole Foods, around the edges of the supermarket, the Whole Foods. Hydration, we're like a plant. You need to water the plant. Exercise, you've got to make yourself sweat and you've got to get out of breath. Exercise is probably the best way to masticate and metabolize trauma. If you had a traumatic day, like last night, I had a really sick septic belly, and then I had a complicated, complex C-section. And this morning I got off work and I was tired and sleepy and wanted to go to bed, but I made myself go to work out. I work out at a gym that's it's a CrossFit / High Rocks gym. I went and did a pretty tough workout. And as soon as I walked out of there, I was smiling. I was happier. My night didn't feel as heavy. I felt a little bit lighter. Came home, took a hot shower, then took my nap. Mindfulness practice. This is very important. We need prayer, meditation, yoga, qigong, some form of mindfulness practice where we are engaged with our mind, our body, our spirit. Contemplative and restorative alone time. This is just me time where you're spending time in nature or you're reading or engaging in some way where it's just quiet and peaceful and you have time to just sort of set your roots back into the earth and heal a little bit. And then sexual healing. This is my favorite. Marvin Gaye said it best. We're social people. We're people who need touch. We're people who need intimacy. Unless you are truly an asexual person, which I guess that's a thing. I would say that is absolutely non-negotiable, and you might even want to investigate that and make sure that asexuality is not rooted in some sort of trauma in the past. Just be curious about the world, investigate. So meditation practice. We're going to do a real quick meditation here. I think we're pretty decent on time. My favorite is Vipassana. It means to see clearly. It's a method to become a witness to our monkey mind. Our mind's always pulling us in all kinds of directions, either pulling us into the past or pulling us into the future. We sit at attention with an intention and a proper attitude. We go to the breath. We let it be an anchor or a bungee cord that's always bringing us back. We get lost. We realize we're lost. We come home. We get lost. We realize we're lost. Come home. Failure is success. We can close our eyes or softly stare into the distance. Thoughts think themselves. There's no judgment, no critic. Acknowledge your thinking, offer grace to yourself for getting lost in thinking, and return to the breath and repeat. That's all you got to do. So I'm just going to invite you now to close your eyes or softly stare into the distance. You can look at this beautiful picture. We're just going to breathe through our nose, and we're going to blow out. You don't have to sit like a lotus. You don't have to do your fingers. And all we're going to do is be aware of thinking. And if you find yourself thinking, like this is dumb, you just go, oh, that's thinking. I'm going to release that and come back to my breath. If we find ourselves thinking about today, later on today, that's just fortune telling. We're just making lists or trying to live in the future. We say, I'm thinking, I'm going to release that and come back to the breath. If we find ourselves thinking about the past, like our day or something that happened in our childhood or whatever, that's just thinking. I'm going to acknowledge it, release it, come back to the breath. And at some point, you'll notice a silence and a stillness in you. And the crackling busyness of the mind will begin to fade out and slow down. And I want you to think about letting your abdomen stretch out, stretching those vagus nerves, getting to that parasympathetic nervous system, and just letting go. I was lost in thought. I see it. I was chasing a rabbit down a middle rabbit hole. I'm going to let it go and come back to my breath. It's not about the breath. The breath is just a bungee cord or an anchor that always pulls us home. It's just pulling us home. We get lost. We realize we're lost. We don't judge ourselves for getting lost. We love ourselves, and we come home. I would love to teach you more about this, but we're getting a little bit short on time, so we need to move on. I appreciate you taking the time to think about it, to investigate it. I encourage you to do more on your own. Some of the other tools that are very important, and like I said, this is a la carte. What works for you might not work for me. Professional counseling. I've utilized this. It was fantastic for me. Just some cognitive behavioral therapy or internal family systems therapy are the two that I really like and resonate with me. Hypnotherapy, obviously, because I am a hypnotherapist, and I had a life-changing event under hypnotherapy that we can talk about later one day. Support groups. This can be AA, Al-Anon. This can be low-impact debriefing groups just in the hospital that you guys form. I can talk to you about that at any point. This can be church small groups. Which brings us into the importance of being a member of a church, a temple, a mosque, an ashram, some place of worship where you can begin to heal yourself in a spiritual way. It doesn't resonate with everyone, and that's okay. But if it does resonate with you, then I highly encourage you to do that. Meditation that we just talked about, Vipassana. EFT or tapping. This is super silly, and it sounds crazy, but it works. I've utilized this and taught this. It's a emotional freedom technique, and there are 10 meridians on your body. There's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And you just tap on those, and as you're tapping those energetic meridians or those acupressure points, you talk about what you're experiencing. You're honest about your experience. Then you talk about then you run through them again as you're breathing deeply, and you talk about the opportunity for healing is there, and you're open to the opportunity, and then you acknowledge that the healing is occurring. And there's tons of YouTube videos about tapping if you want to try that out. Acupuncture, acupressure. I've utilized both of those. The acupuncture wasn't as effective as the pressure, but they worked. Massage therapy, I'm a huge fan. Yoga, traditional yoga, yoga nidra, and laughter yoga. Yoga nidra is also known as non-sleep deep rest protocols. Non-sleep deep rest protocols are just little guided meditations or guided hypnotism, or they last about 10 to 20 minutes, and they provide you with a deep amount of rest and restoration. You can find those on YouTube. Qigong, I'm a huge fan of that. My favorite practitioner is this Yochi lady, and she mixes yoga and Qigong together. Qigong is just energy manipulation, or utilizing prana if you do yoga, or utilizing the Holy Spirit if you're an evangelical Christian. You just gather energy from the environment and use that energy to refill your cup, to fill up your reservoirs. You have these energetic reservoirs under this metaphor called the Dantian. Forest bathing, this is one of my favorites. It's just engaging in nature, going out to nature, touching tree bark, flipping over rocks. I like to fly fish, and I like to be in streams, and I feel that's very healing to me. Spiritual health, this is a big, long list of why it's important to have spiritual health and to acknowledge that we are physical, mental, emotional, and spiritual beings. But it just means finding purpose and connection to life. Mindfulness and meditation is part of that. Prayer is a form of mindfulness and meditation. Connection to something greater than ourselves. There's rituals and practices, and whether that's wearing a cross, wearing the yarmulke on your head so that you feel, God's always over you or above you. I wear a Sikh bracelet to remind me that we're all equal, and to help people who need help, and to protect those that need to be protected. Forgiveness and letting go. That's one of the most important aspects of being a human being, is being able to forgive ourselves and let go, live by letting go. Spiritual health gives us resilience, and self-care as a spiritual practice is absolutely necessary. If everything I've told you up to this point, if you're a rigid materialist and a reductionist and a rabid atheist, that's okay too. We're all different. But even people who know that the placebo effect is occurring get better. Even open label placebo trials show benefit. Like 1 out of 5 people will receive therapy from that. Historically, the term placebo comes from the Latin meaning I shall please. The mechanism, the placebos trigger release of endorphins. Remember, we talked about getting high off our own supply, the natural's body painkillers and other neurotransmitters. They say a 15-second hug or a 16-second hug increases oxytocin, which is the love hormone, which makes you feel good. If you don't believe it, find somebody you want to hug and hug them and breathe with them for 15 seconds. I promise you'll feel better. And nothing happened. You just hugged someone. The brain's role, it shows that under fMRI, that placebos activate areas of the brain associated with pain relief, expectation, and reward processing. Amygdala decreases. The default mode network drops back. Expectation, if you believe it's going to work, it works better. So just play along. Just experiment with it. Just say that this is going to work. This prayer is going to work. This meditation is going to work. This massage is going to work. Nocebo is very important too. If you have negative expectations, that can lead to the nocebo effect, where patients experience adverse effects from inert substances due to their fear or anticipation of side effects. So fear is one of the killers. This is the Facebook group that I run. We've got about 2,500 members now. We've got nurses, doctors, PTs, OPs, NPs, dietitians, clinical clergy. I highly encourage you to join it and join in on the conversation. It's a hive heart. It works better when there's more people there supporting each other. I try to step back and let the community, take care of each other, but I will step in whenever I need to. These are my references. You feel free to look at those, ask any questions. And I'd like to open up the floor for Q&A. Sorry, that was a lot.
Have We have one question so far, and that is from Cesar Chavaria, who says, how do I decide if I should retire or slow down? Uh, Maria, do you want to make an announcement about the poll, or you just there's a poll, there's a set of questions for
That's
you?
okay, Dr. Overstreet or Rodney.
Yes.
The questions that you submitted, we put a poll together, and we're hoping the audience will partake, and you can answer the questions at the end.
So I'll answer the question first. That's a fantastic question. I think that if you're at that intersection in your life, one of the best things that you can do is to step back for a period of time, take a little break, and during that break, have some quiet time where you go into the forest, go into your church, go into some sacred place that's quiet and peaceful for you, and do some meditation and do some soul searching and ask yourself, is your work done? And I feel that if you do that, an answer will come. And then you can also ask God, ask the universe, ask the spirit, is moving forward in caregiving better for me than it is to retire? And if that answer is yes, then you need to keep moving forward. There's still work to be done. If the answer is no, then it's very clear that your self-care and your healing is more important, and maybe it's time to step away or step back into another role or just take a break. Regardless, I would engage in some of these healing activities, a lot of these activities. I would rummage around in the toolbox for a while. Sounds like you need some deep healing. There's another modality I didn't talk about that's starting to gain traction, and that's ketamine-assisted psychotherapy. And we're starting to find tremendous results for people who have burnout, suicidal ideation, treatment-resistant depression with ketamine therapy. And so if you find yourself at the end of your rope and you've got some of those issues and you've tried traditional therapies and it's not working, I would encourage you to try to find a mental health caregiver and a ketamine clinic and give that a shot, give that a try. Because it's literally like pouring Miracle Grow on your neurons. It causes BDNF, brain-derived neurotrophic factor, to be released into your brain. And so your neurons have dendrites, and the dendrites cause crosstalk. And social neurons are like social people. They're happier. And so these neurons that have been pared back over the years because of disease or trauma begin to sprout rootlets again and have this really beautiful crosstalk. And you find people who have healthier brains, higher levels of neurotransmitters, serotonin, dopamine, and higher quality of life scores. Is there any other questions? Anybody want to talk about stuff? Or call me out on anything. Like, I love to talk about this. I'm happy to.
Thank you. Can you hear me?
Yes.
So that was super helpful. I was the one with the question, and I've been watching YouTube videos trying to decide if I should retire or not. And one of the things that I've been listening to is that after decades of being under stress, we just consider it normal. You know, we don't know a different routine. It's just kind of being stressed out is kind of, you know, daily life. So
yes, sir.
Your recommendations were super helpful. Thank you.
Yeah, absolutely, man. Thank you for the love and compassion and care that you've poured into your community for whatever period of time you've been doing that. And so I think one of the best things that you can do is realize that you've been stuck in a system that that wasn't set up to make you whole and heal you and help you. And that's an institutional failure, an educational failure. And I'm working on resolving that. But in the meantime, with this knowledge that you have now and these tools and joining our support group, you can begin to re-envision your life, and you can begin to engage in activities that can start stripping away those decades of stress and compassion fatigue and moral injury. And you may find that underneath all of that, if you've done some intense work, whether it be Jungian shadow work or talk therapy or maybe you need to go on a spiritual journey. But there is still that bright-eyed, young, caring individual who's still there and who still yearns to make the world a better place in whatever capacity that you can. You've been slimed, and you've been slimed for a really long time, and maybe you didn't even know you were slimed.
Thank you.
Yes, sir. Thank you.
Thank you, Dr. Chavaria. That was really very good, and I agree with you wholeheartedly on that. We've had Mr. Overstreet. I can't thank you enough for all this content which you curated, put together. I think it's very fortunate that the people who attended the live stream will be really beneficial. But I also record and post your video online for on-demand viewing at a later date. So I'm hoping a lot of people will take advantage of that and watch it. Anyone else has any questions to ask directly from Mr. Overstreet?
Shall we share the answers to the poll in the meantime?
Oh, sure. Of course. Yeah. There we go.
Rodney, would you like to go over the questions and answers?
Oh, yeah. So I see number one, the following symptoms characterize compassion fatigue. So all of the above: emotional exhaustion, reduced empathy. Reduced empathy is one of the hallmark components of depersonalization or derealization, where you begin to kind of act like a robot or see the world as not being real. And that shows that you're incredibly traumatized. And then the physical symptoms we talked about, when the mind and the soul are hurt, the body will call out for help. And so all of the above. Number two, emotional regulation and surveillance are accomplished via the mindful mantra or self-awareness. This process is known as interoception. Good. I didn't cover that as deeply as I wanted to because we're short on time. But part of the meditation is a body scan. And meditation is really just becoming a dispassionate observer of yourself. And as you sit quietly, when I'm teaching brand new meditators, and physicians are fantastic at this, I just tell them to imagine you sitting in front of you. And there's a version of you that's just, Rodney. And then there's a version of you that's Dr. Overstreet with the glasses and the pen ready to write on paper. And all you do is you're just investigating yourself. You're watching yourself. And every time you find yourself lost in thought, you just go, hey, you're lost in thought. You note it. You release that. You go back to the breath. And so you're just an observer of your mind. And so when we become that observer of our mind, we can do what's called a body scan, and we can pretend like we're an apple slicer, apple peeler, or an old-fashioned typewriter, and we just start at the top of our head, and we just work our way down to our eyes, our jaw, and we look for tension, we look for anxiety, we look for stress, we look for balls of energy, we look for places that are vacuums that need energy. Maybe our heart is got a hole in it, or our stomach's got a pit in it. And we breathe into those spaces and we refill those spaces. If we find a space that's tight or has sadness or anger, we breathe into those spaces. So that's a form of interoception, of checking in with our body, so that we can find out issues inside of our bodies. Which of the following is not a symptom of PTSD? Intrusive thoughts, we know that is detachment, hypervigilance, and avoidance. Those are all symptoms. I don't have all of the above on that one. Was there all of the above on that one? Intrusive thoughts definitely are. Detachment is probably detachment would be the lowest of those options. But hypervigilance definitely is, or hyperarousal, and avoidance certainly is. You want to avoid instances that are similar to the instance that it caused you to have your trigger. And that's just avoidance of the triggers, because the trigger is so painful as it pulls you back into that into that reality that you lived. All I see is 3. Is that it?
There's one more, avoidance, at the end.
I don't see it.
Yeah, that was
I
the
think you have to
fourth
scroll
choice.
down.
I'm scrolling and it's stopping me.
Yeah, the last one is avoidance. So we have intrusive thoughts, detachment, hypervigilance, and avoidance, which generated 22% of your response, 56% for hypervigilance, 11% for detachment, and 11% for intrusive
Hypervigilance would be like hyperarousal, the same thing, stuck in the sympathetic nervous system. So that definitely is a symptom of PTSD.
Yes.
But good. Even wrong answers give us an opportunity to talk about it and make us more aware of it. Remember, HAIR, HAIR, hyperarousal or hypervigilance, avoidance, intrusive thoughts, and reliving of the situation or the trigger. I'm super grateful and thankful for you guys for having me today. If you would like for me to come out and talk about any of these things or do any workshops for how to do a low impact debriefing or how to do body scans, meditation, laughter yoga, a little qigong, a little meditation, I'm happy to do that. Just reach out to me. In the meantime, please join Heal Our Healers on Facebook and get involved with the conversation.
Well, thank you very much for attending, everyone. I hope you had a great presentation from Mr. Overstreet. Lots of information. And once again, I want to thank you for attending on behalf of St. Joe's Burbank. We want to thank our speaker, Rodney Overstreet. We want to thank Maria for her help with developing. Hope you enjoyed the poll questions. Have a great afternoon. And until next time, we have another CME tomorrow. And that is coming to you from the Neuroscience Lecture Series. So hope to see most of you there on that CME. And then we have another CME on Thursday as well, coming to you from Providence, Little Company of Mary Torrance. Have a great afternoon, everyone, and take care of yourselves. Be safe and be well.
Thank you, guys.
Bye now.
Thank you.
Thank you.